All right. Hi, everybody. Good day. It's the new year. I'm really excited about this new year and having to come back on the podcast series to serve you with the hottest gist, the biggest lesson, the value, the gems of building for healthcare. This is the HSB podcast again. And this year we are back bigger, better, and more aligned to make sure that healthcare leaders across the globe are well positioned to save lives and help patients globally. And today we're starting off with a local leadership series with a super amazing guest on the podcast today. I have no other person than Dr. Ernestine Watson. I would say the first time I met Dr. Ernestine, I was like, who is this? Who is this woman who is fighting for patients? Who is this woman who is so passionate about, making sure that patients have access to life-saving medicine? And today I am beyond honored to have the privilege to have her on the local leadership podcast series. Dr. Ernestine here has over 30 years experience in the healthcare industry, and today she's going to be sharing with us some of our valuable lessons on balancing evidence, emotion, and urgency when you're leading for healthcare. So before we get started, I'm just going to allow Dr. Ernestine to quickly introduce herself to us and tell us a little bit about herself. So over to you, Dr. Ernestine.
Hi everyone. Thank you for having me. I am, as you said, I'm Ernestine Watson. I am a Trinidadian, now living in Jamaica for
Wow,
many years.
that's really
Yes,
exciting.
yes. I am a mother of two, a grandmother of two. I am a businesswoman. I also do research, lecture, and I believe in the Almighty and powerful God.
Oh my God, that's I always love it when people come with that ending. That's actually a believer. So thank you so much, Ma. I really like the fact that you mentioned that. Thank you so much. You see, she's a woman who's wearing so many hats. And she has seen life, she has experienced life, she has also done many things in the healthcare space in helping patients. She's not just a woman, she's a woman with so many codes, so many things she's handling. And that's one thing I really admire about her. Dr. Edison, I really want to thank you again for being here. You have over 30 years experience in the healthcare industry, right? Helping to fight for patient access to life-saving medicines. And that's where I met you. I met her at a very big conference where we're talking about fighting for medicine as access and safe and efficacious medicine. And I was like, who is this woman? She looks like the Dora Akoyili, It's a Dora Akoyili of Nigeria who fought for patient access. And really, you are the Dora Akoyili of the Caribbean. So, Dr. Ernestine, we're just going to start off with a very quick and just flowing conversation. And I want us to just enjoy this conversation. I know the podcast, but I am here to enjoy and learn from you because having the opportunity to learn from someone who has led for 30 years, I don't think I'm going to take it for granted, Ma. So, Ma, I'm going to start off with your background. You're a pharmacist, right? And you have
Yes, I
experience,
am.
you've walked through the pharmacy profession, but I always like to start the podcast with my leaders who are leading in healthcare with the question, why did you choose to do something in healthcare? Why did you choose to pursue pharmacy and that line of career in your early career? Yes.
Actually, I always loved medicine, healthcare, healing. And as a teenager, you're trying to decide what you're going to do. So my father said to me, why don't you be a pharmacist?
Mm.
Actually, he didn't say pharmacist because in those days we were called druggists.
Mm.
And of course, I said to him, no way. Because at that time, the image you had of a druggist was an old man in this long white coat and, a young woman looking for excitement. That didn't fit well. So my father, he was a very intelligent person. So what he did, he said to me, well, go and do a summer internship at the pharmacy. At the time, the druggist lived next door to us. So I got an opportunity to do the summer there. And I was hooked. I learned so much. I found it extremely interactive, helping with patients and at the same time learning techniques and, learning the basics of healthcare and pharmacy. And so I'm here up till today.
Wow, that's a very inspiring why though. Like, so you decided to try your hands on the pharmacy internship, and I think you mentioned something very valuable here. You never know what you're really interested in until you try, and because of your dad, he's one of the inspiration of you pursuing that degree. And thank you, shout out to your dad, who made you pursue and who has made you now become a leader in this space. Did you ever imagine that this would be how your career would have gone, even when you were back then when you started the internship? Did you ever imagine that you would be fighting for patient access to life-saving medicines today?
Well, actually, knew that I wanted. I became hooked on pharmacy and I became hooked on business as well. So I wanted to be a community pharmacy because in those days, the pharmacist, the druggist was like very important, and they were intervening in so many different aspects of life. Counseling, patients would come for medicines, and so it intrigued me. So I was impressed and wanted to do both business and the pharmacy.
That's amazing. Wow. You're just like me because I also that was one of the reasons why I chose to pursue a degree in pharmacy, because there was this pharmacist very close to my neighborhood, and I noticed that a lot of people used to come there and people used to buy medicine, and I was always excited. Anytime anybody is sick in my neighborhood, I always ask them to send me to the pharmacy because I just loved the whole ambience. People are coming for care, people are paying money, and the business side. And so thank you. That's really also very inspiring, Ma. So Ma, you have led in, this space. You're not just a community pharmacist, you've done a lot. Like, you are speaking globally, you are traveling, you are fighting for policy, you are doing all of these things in the Caribbeans. What would you say was your call? When was the time when you know determined the call for leadership? But maybe before you answer that question, the theme of this podcast is called local leadership, right? And local leadership, we have a reason why we called it local leadership, because now everybody's saying, I'm a global leader in this space, I'm this in this space, I'm this in this space. But at the end of the day, we forget that leadership is local. So I would like to ask you, what's your take on local leadership, and when was that defining moment when you realized that I have to step up into leadership for healthcare?
Okay, so my call to leadership, I recognize, came pretty early because at high school in Trinidad, I got involved in sports. I
Oh.
couldn't run, I couldn't jump, I couldn't do anything, but I could cheer, right? So I became a cheerleader. And then at a very early age, actually in fourth form, I was selected to be the house captain, which is not normal for a fourth former. That would be in the higher grade. And then from there, I became head girl. And I think my advocacy, I always want to stand up for what is right. I am also quite enthusiastic about doing things and getting things done. So, in pharmacy, as a community pharmacist, I recognize that there were lots of areas where the pharmacist could intervene. So, as my pharmacy, we became involved in going out on health fairs, doing lectures at high schools, and getting groups together. I became involved in the Pharmaceutical Society of Jamaica as the coordinator for the education committee. So we organized things like public forums and, just getting involved and getting a voice. You need a voice. And I found that I was able to communicate and to get persons to come together. So I felt that that strong point could be used for the benefit of our profession.
My God, that's so succinct, and I really love the fact that you mentioned that you discovered this even back then when you were in high school, just leading people, how you're able to command, and just even the urge to stand up for people. And I think you've done that excellently in your career, and I'm so proud of all you've achieved, Ma. 30 years, oh my God, you're actually training us to actually yearn for more, and I really appreciate. I hope that everybody who listens to this takes something out from what she said, right? When you have an inner calling, do not just hide your light. You have a mandate to stand up and fight for people wherever you find yourself. Not fighting because you want to fight, but because you have to stand up for what is right. And that is what Dr. Ernestine has summarized her leadership journey and why she was called into leadership. So Ma, let's maybe deep a little bit deeper into the space you are playing, right? And I find this space very exciting because one of my role models in Nigeria, her name is Dora Akunyili. Shout out to Dora Akunyili, who fought for medicine access for patients all over the continent of Africa, but specifically in Nigeria. I know this space is one very dicey space that, as a woman, you have to, balance the evidence, the emotion, and then the urgency, right? And that's the theme of this podcast today, where you have to balance evidence, which is like substandard medicine. You are saying that the medicines are actually substandard, and then your emotion as a person that okay, if somebody is actually taking these and the person is actually having issues, and then the urgency to act, right? How would you say you've been able to do this, right? What are those lessons you've learned in your leadership journey in balancing these three very different emotions, ma?
Okay, so the first thing is that you have to recognize that policy matters,
Mm-hmm.
but we are also emotional beings.
Yes.
And we want to ensure that the people who we are serving, we are policies that we are advocating for will make a difference. Patient
Mm,
care must always be at the forefront.
absolutely.
Whatever action we take, we must consider how is this going to affect the patient, and is
Mm,
the patient going to be able to benefit from our actions.
mm,
But then we also have to consider that persons are emotional beings. So you
mm-hmm,
can't just say to a person, do X or do Y. You
mm-hmm.
have to get them to buy into what you are literally, what are you selling to the person? You
Yeah.
want to get better health care. You want to help them to make better choices. But at the
Yes.
same time, it cannot be a blanket thing. We have to consider
Mm-hmm,
how is that person going to react? And
mm-hmm,
it comes down to the individual. So
mm-hmm.
we have to reach them on a personal basis. So we have to go from an emotional point of view, from
Mm,
that standpoint. But then there is also the matter of safety and the matter of the community. How is it going to affect the community? We want to affect the individual, but we also need to study what is the effect on the community. And
mm-hmm.
then there's also an urgency to get things done. So sometimes you want to try to speed up how things are done. But
Yeah.
at the same time, we have to ensure that whatever process we take is not going to affect the very community and the very individual that we are trying to assist.
That's very true, ma. Like because at the end of the day, you're dealing with people, right, in your leadership journey, and you need to know how to communicate with them because they are also emotional beings. And at the same time, you're trying to be urgent. You're trying to make sure that things are safe, people are not dying, and you've done that well in just highlighting the fact that you have this. I think one of the things that many people don't realize is that leadership is leadership, but leadership in different sectors are very different, right? So a leader in a say in a let me say in a pharmaceutical company, because this is the space we are talking about, might need to lead differently from a leader in a hospital setting. So let me give an example. In my MBA course, we did a course, they gave us a case study, and in that case study, it was talking about a pharmaceutical manufacturing plant and company that had just recently made a batch of products, right? And
Mhm.
in the process of quality testing, they identified the fact that the product was just a little bit substandard, right? Let's say about zero point 0.0. So it was not so significant. And they gave all of us the case study and asked us what were we going to do in that situation. I am a pharmacist, right? And I was sitting in the room and I told them that I was going to release the batch of the medicine. It was an ethics class. And some of my classmates were like, but this thing is, they notice that it's not up to standard, it's not 100% standard. But me, I was like 99.99% is actually standard. But after thinking about it for a while, I realized that yes, the company might have spent millions of dollars in creating that batch of commodity. But at the end of the day, when you release that commodity, right, it's going to affect the patient. People are actually going to may not get the
Human
efficacy.
beings are going to be taking it.
Exactly, ma. So it's very hard to balance that evidence, the emotion, the money you spend, the opportunity gone. But one of the things that I've come to realize is that leaders in healthcare have a particular necessity to uphold ethics and integrity in dealing with their business. And that's why I really loved your response in the fact that you have to balance all of these things. And that's the peculiarity of leadership in healthcare. And that's why we have this podcast to really continue to sound it, that make the soundboard, that leadership in healthcare is very different. So, but I don't know if you want to add one or two things to what I've said, and also maybe just tell us some of the lessons or maybe a real life example of how you've seen this play out in your career and how you've had to balance those evidence, emotion, and the urgency.
Well, for example, coming down to from a regulatory point of view,
Yeah.
drugs that are imported into Jamaica.
Yeah.
Persons want to get access to the
Mm.
medication. So we have to balance
Yeah.
quality, standards. At the same time, we need to have access to the medication that would alleviate.
Yes.
So, one of the things that we have to do as regulators, for example, from the Pharmacy Council point of view,
Mm-hmm.
we have to ensure that we are looking at both sides of the coin.
Yeah.
Yes, standards must be maintained, but how can we be more efficient so
Mm-hmm.
that the medications that are required, that are desired,
Mm-hmm.
would still come into the island, meeting the standards, the high quality that we desire? But how
Yeah.
can we process those at a faster rate so that patients are not denied the medication that
Mm-hmm.
they need? Those are some of the things. For example, the use of generic, when the generic drugs were being introduced,
Mm-hmm.
that was a big debate and a cause for concern from some areas of the pharmaceutical industry, because standards, the persons were worried about whether standards would be upheld.
Mm-hmm.
And at the same time, some persons were saying, but we are not getting the medication. So many people are unable to afford the medication. So, what we had to do is to ensure that we have standards that would allow the medications in. And as long as one of the things is that, for example, a drug that is imported into Jamaica must be distributed in the country of manufacture. That's
Mm-hmm.
one way of ensuring that we can monitor the medications that are coming in. At the
Mm-hmm.
same time, we need to ensure that the system that is approving the medication is efficient so that we do not have overdue long delays that will prevent persons from getting the medications that they desire.
Absolutely. Thank you so much, Ma. I think that is really the thing about leadership. You have to manage all of these things, and balancing them has to come with different contexts, right? It might not be the same way you handle this situation that you handle that situation. And that is why leadership is actually one of the most valuable skills to have. And Ma, you've done this for 30 years, and I really, really know that you have learned a lot, you've seen a lot in the space. And I'm so grateful for you sharing your experience with us today. So I'm just going to move to the next question, right? Which is what you have done, the business and the healthcare. And I think that's one thing that we need to really continue to talk about, right? How do you balance the business side of the healthcare, right? And in your journey, you've said a lot. I think you've done a lot of business, entrepreneurship, innovation, education space. How would you say you've balanced this also? Like, and what are the lessons you've learned, from just building for healthcare in the Caribbeans and innovations and managing, all of these pieces in the business side of health?
So, first of all, I am a pharmacist first. So, in my business, I always have to take what is the effect on my patient, on dealing.
Yes.
Day to day, you have so many situations that you have to deal with.
Yeah.
So, for example, patients would come in and they want a medication. They want it without a prescription. How are we going to address it? Is it that what is the first consideration? I have to consider the legality. I have to consider the patient. I have to consider from the business point of view. So my first consideration must be the patient. I have to consider how the legality of what I want to do and my integrity, and how can I operate my business so that I make a profit and stay in business. That has been always my decisions. I do not compromise patient safety. I do not compromise going against the law. What I do is that I ensure that I build relationships, I educate my patients, I invite them into. So, for example, when we have open days where we invite patients to come in, bring your medications, we do drug reviews, we do therapeutic analysis, we do clinical talks. All of these things will help patients to improve their trust in the business as a pharmacy, as a healthcare, and at the same time, it is going to improve your bottom line because you have build relationships, you build loyalty, and you have patients coming back to you. I have patients that have been with me from I opened business
Wow.
30 something years ago. I have
Wow.
patients who sometimes they come back and they bring their children and they say,
Mm.
you remember this one, right? It is, I have patients. I am currently in Kingston, in Jamaica, but I have patients from both sides of the island, from Port Antonio to
Wow.
Negril. They come in. You provide an environment. Recently, a patient said to me, I go where I am cherished and appreciated. So she keeps coming back because she gets the service. She believes that we are caring for her.
Yeah.
And more importantly, she's getting current
Mm,
information. So you
mm,
have to be up to date. You have to be caring. And as I said, if you love what you do, you will
mhm.
do it with joy. And that communicates to the patient and they feel special.
Wow, wow, wow. Definitely, definitely all you said is amazing. I love the fact that you are taking a patient-centered approach even in your business. And when you're innovating, you are keeping them in the front and making them feel valued, seen, and not just as customers. Because I feel like that's one thing that we need to learn better in healthcare, right? Because you see a lot of people complain. I go to the hospital, doctors complain about the attitude of doctors, and I don't blame them because even doctors, me myself as a healthcare professional, it takes a lot to build relationship with your customer, which is the patient. And sometimes we can be emotionally attached, sometimes we can be emotionally unattached, and that's bad balancing the emotions because like you built a relationship and somehow you are emotionally attached to your patient, and sometimes some people argue that that's not good, some people argue that that's great, but at the end of the day they are people and they need to be seen, feel valued, and feel cared for, which is the reason why they have come to our healthcare.
Exactly.
Thank you so much for sharing that with us, Ma. I think we're just gonna quickly just wrap up a little bit and just begin to talk about your reflection journey. Maybe just what advice would you have for young professionals who are just starting off their career? I know it's something that I just want you to just share from your leadership experiences. How would you, if you were to start your leadership journey all over again, what would be those valuable lessons that you would like to share with us in terms of like our journey and how we can navigate healthcare as a leader?
Actually, for me, I'm very excited about where pharmacy is. When I was thinking about, what can I share for
Mm,
a young professional,
yeah.
just as a throwback, when I started in pharmacy, we graduated with a diploma,
Mm,
and it meant that you could not go on to do an MBA or to
mm,
specialize. You had to then, after working, you would then go back and get a degree.
okay.
Now, first of all, in the Caribbean, there are many schools of pharmacy. And in
Yeah.
Jamaica, for example, there are two. So you have the University of Technology and you have the University of the West Indies Pharmacy School in the Department of Medicine. So there are many opportunities for improvement. There's also a lot of opportunity for you to be creative because you have for example, something like this podcasts,
Yeah.
continuing education, research, innovation,
Mm,
creativity. There are so many areas. I have seen young pharmacists set up something like a group where they train others
mm,
to achieve goals. So, for example, if you want to specialize or you want to do certain exams, they have these groups. Persons who can go, you like writing, you can go into literature, you write articles. Once upon a time in the Caribbean, if you were looking for a topic, you could not get research published from the Caribbean. Now, many pharmacists who are actively involved in research and producing literature as well as books. So, my one of my mentors, Dr. Brown Myrie, and Mrs. Reed, they published a book on education, the journey of education within the Caribbean. So pharmacy is dynamic
mhm.
and it is also opening up a lot of opportunities because there's room for you to express yourself as individuals. If you love what you do, you will go very far because then you begin to get very creative about how you approach it.
Wow. Thank you so much for sharing that. I hope everybody who is listening is learning that constant test for knowledge. Keep learning, keep educating yourself, keep improving, keep networking, collaboration. Very, very important. That's the way to stay updated in this world. And people like Dr. Ernestine has shared her wisdom with us on even what she's still doing in this space. I know I met her at the networking event and despite the height she has reached in her career, she's still going out, constantly thirsting for more knowledge, more opportunities to do more in the healthcare space. So yeah, this is a challenge to all of us to continue doing this, and that's the way we keep the space going.
And one thing I would say for as a Caribbean region, that we would continue to network and collaborate. So, for example, in terms of policy decisions and policy changes that are required,
Yeah.
development, changes in the legal, in the Pharmacy Act, so that we can incorporate more of the modern things that are happening. Pharmacists expanding their roles as immunizers and e-prescribing, and for example, pharmacists who are the next route is for pharmacists to become prescribers, right?
Mm.
So there is a lot of opportunity, but we have to take it as a group. The Caribbean Association of Pharmacy, there's a lot of networking going there. So I would encourage that we continue that route and we start with collaboration so that we can achieve. If one achieve, all can achieve.
Yeah, I love that. If one achieve, all can achieve. That's one thing that we need to learn how to collaborate better to make sure that things are working in our space. Thank you so much, Dr. Ernestine. This has been very, very exciting. I would end with this question, which I always end with all my guests. Two questions actually. The first question will be, if you had a magic wand, right? If you had a magic wand that you want, you can just do like this and wind and make a wish to do something in healthcare or in the pharmaceutical space, what would you make a change in today?
Changing mindset.
Hmm.
If I can get all healthcare personnel
Hmm.
start with preventative medicines.
Hmm.
So from very early, we need to be talking about how can we prevent disease rather than
Hmm.
focusing so much on how can we cure
Cure disease.
disease. Yes, we may need cures, but we also need to be more actively involved in prevention. And one of the first things that we need to do is what we put into our bodies.
Hmm.
Modern science has created a lot of additives to most of the things. So probably we need to go back to the basics.
That is very, very interesting. Thank you for sharing that. I think that is also very fundamental because people think that I just come up with an app or come up with a solution or an innovation and that will change people automatically. But no, you have to go back to the social behavioral as attitudes, the psychographic nature of human beings, the way people behave. Actually, it's very important. And I wish I also had that magic one. I'll also do that. Thank you, Ma. So, Ma, I'm sure that in the course of your journey, there have been many times where you have felt like, I'm tired of doing this. I don't want to do this anymore. Maybe no, maybe not. Maybe because you seem to be very inspired in, healthcare and pharmacy profession. But I know that everybody does have their moments where they're like, oh, leadership gets to you and all. So I always ask my guests, what is that fundamental habit, that principle, or that quote, that keeps you anchored, right, in the process of your career, right? Or anything you think about that quote, because we always like to ask them, what's that anchor or that quote that or that principle that you remember anytime you feel like I need to get going over the course of the years.
If I am not loving what I'm doing, then I
Mm,
stop it. So you have
mm,
to love what you do. I don't give up easily either. If I am convicted about something, I pursue it. I am consistent. So you have to love, really love what you do, strive for excellence. And if you feel at any point in time
yeah.
you are no longer interested,
Mm,
maybe you need to look at, are you taking care of yourself? Because
mm,
sometimes we get so involved in
yeah.
doing and doing for others, we neglect ourselves. And remember, whatever you put in, it's only that can come out. So
Mm,
you have to ensure that you keep feeding yourself, you keep building yourselves.
yeah.
Education, continuing education, rest, relaxation. It's not a
Yeah.
bad word.
I love it.
Yeah. And keep loving what you're doing.
Wow. Wow. This is from somebody who has, everybody, this is from somebody who has done this for 30 years. And I don't think there is no better way to put it, right? I think it's very important what you said. If you don't love it, then I stop it. Strive for excellence. So that's the quote Dr. Ernestine is leaving us with today. Make sure you continue to strive for excellence and be true to yourself. I think for me, that's what I get from what she's saying. Be true to yourself. Find out what you love. stay in it and strive for excellence in what you're doing. Thank you so much. I think this is something I need to write because I always write all the quotes that all my guests share so that every day I look at it. Oh, okay, this is what Dr. Ellison has learned for 30 years of her career, and this is what she's leaving us with. So thank you so much, Ma. This has been a very insightful session. I have learned so much from you and even your journey as a leader in balancing evidence, emotion, and urgency. And I think for the space we play in, particularly in the pharmaceutical space, this is very, very important because this is patient life at stake, and every decision matters, every action matters, every inaction actually also matters. And it is very, very important that we learn to stand up for what is right. Like you have said, that advocacy spirit in us, we should not let it down. And so thank you, Ma. I don't know if you have any last words for the audience. Any last words you would like to share?
I would just say that in my journey, my
Mm,
faith has brought me through many difficulties, many situations where I literally felt that I would not make it through. But I look back and I realize that I've come through. And also look out for those who have been put on your path to assist you along the way, because at many points in time doors open. For example, meeting you was a
yes.
door opening for me, and I stepped into it. I came to the conference, and I am telling you that experience is one of my highlights of my
Mm,
career. Being
mm,
in a room with so many persons who
mm.
have so much to give, so many titles behind their name, and yet you are there and you are contributing. So
Mhm.
look for the doors that will open, and look for the persons that the Lord will put in your way to assist you,
Thank you so much.
because we can't do it all ourselves.
Definitely, we can never do it all by ourselves. I think that is one thing I'm anchoring my mind to this year. I'm big so much on collaboration and partnerships because you can't do it alone. And thank you so much for sharing that. You need to anchor yourself on a faith. I'm also big on my faith. And I think it's very, very important that we mention that anchor and that support is something that we should not play with, especially as leaders in healthcare. It's very, very important to draw strength from somewhere that is bigger than us. Thank you so much, Dr. And thank you to all our audience who are going to watch this podcast. I hope you've learned one or two things from the journey of our very, 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 very fantastic guest here who is fighting for patients' lives in the whole of the Caribbeans, making sure that you have the access to safe medicines and efficacious medicines. And so thank you, Ma, for today. I am so excited. Everyone, this is the HSB podcast series, the local leadership series, which is one of our podcast series. We also have the system series, and we also have the market and the status spotlight series. And today on the local leadership series, I am beyond honored to, close out on our guest for today, Dr. Ernestine, who has had an amazing 30 years in this space, and she has shared with us some of her lessons. If we were to pay her for these lessons, we have to spend 30 years, and I don't think I have that amount to pay for 30 years of going back to the university for 30 years. But she has liberally shared her lessons with us, and I hope that we implement and learn one or two things from her journey. So thank you so much, and please let somebody know about the podcast and stay tuned on this journey. Thank you so much, and do
Thank
have a
you.
great
Thank you for having me.